We're back at 7:44 this morning. Thanks so much for staying with us. November is Lung Cancer Awareness Month. Across the country and the world, people are focusing on early detection, identifying at-risk behaviors like smoking, and spotlighting research and new advances in diagnosis. I sat down with an Atrium oncologist to learn more. Thanks for joining us. According to some statistics, lung cancer is one of the most diagnosed cancers in both men and women here in the U.S. So joining us to take a closer look at lung cancer and advances in diagnosis is oncologist Dr. Rogerio Lilenbaum of Atrium Health Navicet. Thank you so much for joining us in the studio this morning.
Thanks for having me.
Of course, talk to us a little bit about November being Lung Cancer Awareness Month.
Yeah, it's a special recognition for all those individuals who have suffered from this disease and their families who made that journey with their loved ones. It's a difficult disease. It's one that takes a huge toll on individuals and families, and it's our time to recognize them and appreciate what they all have been through to get to the other end of the line.
Yeah, of course, with any diagnosis, education is really important. So, help us understand what are some of the warning signs of having lung cancer.
Yeah. So most of the times it will be a combination of respiratory symptoms such as cough, shortness of breath, occasionally chest pain, along with just a general sense of malaise, weakness, lack of energy, weight loss. Yeah. So those are some of the warning signs for the typical patient with lung cancer.
Yeah, oftentimes when the everyday person thinks of lung cancer, they think of someone who might often smoke, as a habit. Is there any connection to someone who does smoke in lung cancer?
Absolutely. So individuals who have smoked or who continue to smoke are at a higher risk for developing lung cancer. Nowadays, up to 75 to 80% of lung cancer diagnoses are made in patients who have a smoking history. It's also important to realize that about 15 to 20% of patients do not have a history of smoking and can also be diagnosed with lung cancer. So smoking is the most important risk factor for lung cancer.
Yeah, what should people know in regards to misconceptions when it comes to lung cancer? Are there any misconceptions that you often hear that people have?
Yes, so thanks for that question. One is that lung cancer is always a fatal disease, which it isn't. Lung cancer, when diagnosed early, or even at times at a later stage, can be successfully treated and at times cured. So if you are diagnosed with lung cancer or you think you may have lung cancer, please seek medical attention immediately, because nowadays we have a wide variety of tools to effectively treat this disease. The other misconception is for individuals who are still smoking, that why stop now? Why would it matter? I already have the disease. I'm going to continue to smoke. That's a misconception, because patients who quit, and it's been documented in the medical literature, they tend to do better. Their symptoms improve and they go through treatment more successfully, more easily than those who continue to smoke.
Yeah, one of the things that you just mentioned was the wide varieties of tools that are now being made available to you. Obviously, we are in a very technologically advanced world. What kind of new developments have recently come out that have been helpful in kind of fighting lung cancer?
So when I started to take care of lung cancer patients a couple of decades ago, we only had one treatment that we could offer to almost all patients with lung cancer. One type of chemotherapy, which at the time had very modest effectiveness and a lot of downside in terms of side effects. We are in a very different position nowadays. We have what's called targeted agents, that target a specific molecule or a driver of that cancer in the tumor cells. They are incredibly effective. And then even more recently, the advent of immunotherapy drugs that manipulate your immune system to fight cancer cells. So today we see already in the past decade a significant decline in the mortality of lung cancer. So we have a variety of options. There are also innovative techniques to diagnose lung cancer at an early stage, which is the best prognosis, of course. One is the ion navigational bronchoscopy. It's a tool that has emerged also within the past 5 to 8 years, and it uses a navigational technique that allows the pulmonary physician to identify and precisely take a sample of a nodule or a spot that is typically not reachable by other techniques. It has really changed the way we approach the diagnosis of lung cancer. And another one is for individuals at risk for lung cancer. We have lung cancer scans that can detect lung cancer at a very early stage. It's mixed. It's been received with mixed reactions. The primary care physicians don't necessarily recommend that approach, not as much as they recommend a mammogram or a colonoscopy, and we would like to get to that point. So we continue to work with the medical community to demonstrate the benefits of early detection for lung cancer.
Yeah, very good information there. It's always interesting to see how technology is kind of helping do the work that you guys do. Anything else that people should know before we let you go about lung Cancer Awareness Month, you know, how to be proactive about it, anything at all?
Yeah, so be mindful. This is a disease that can affect individuals who never smoked. So make sure that if something doesn't feel right, that you seek medical attention. And then the other comment I would make is every new tool that you and I just discussed in the past few minutes was at one point subject of clinical research. So please ask your physicians about clinical trials. Please ask if there is a study or a research project that they can participate, maybe about a drug that hasn't really made into the market yet, and if successful, will be the new treatment for lung cancer. This is how we make progress, so research is very important for everyone.
Yeah. Don't forget that Lung Cancer Awareness Month isn't just the month of November. This is a year-long thing. Of course, if you do feel something or something seems a little bit off, that you go see a physician, go see someone that you trust, and say something.